Hello, my name is Eric Sassoon, and today I will be speaking about the awesome subject of, you ready? Pain. It's about pain and how to manage it. Why pain? Well, nobody likes pain, but guess what? Without it, you would have major problems. According to National Geographic's wellness issue titled A World of Pain, pain is essential to humans and the animal kingdom to minimize bodily injury and safeguard self preservation. According to PubMed's article entitled Relieving Pain in America, a blueprint for transforming prevention, care, education, and research, 30% of people in the United States, that is to say 100 million adults, suffer from chronic pain. These patients live with chronic pain resulting from cancer to diabetes to neurological illness. In the medical world, local and general anesthetics are some of the choices to deal with pain. How does pain work? Well, it's a complicated process. Let me try to shed some light on it. So we have these sensory neurons called nociceptors with a specific function of responding to any external stimuli. Hot, cold, sharp, or soft objects, the list goes on. When they're triggered, boom, they transmit electrical signals through axon nerve fibers, through the spine, to the brain. And the brain responds accordingly to the specific painful stimulus. In this discussion, I will be focusing on two areas of pain management: local and general anesthetics. I will provide a brief description, talk about their mechanism and their methods of administration, as well as the major classes of each one of these classifications. Of course, followed by a brief conclusion. Let's start with local anesthetics. According to Henry Hittner's Pharmacology and Introduction, local anesthetics inhibit pain sensation in a selected specified area of the body, hence the word local meaning localized. During this procedure, the patient is fully aware and conscious of what is taking place. Their sensory neurons remain unaffected. The local senses are attenuated, and with minutes to hours from administration, the sensory function returns to normal. Let's discuss the mechanism of local anesthetics. Now, let me direct your attention to one thing. The greenish turquoise area represents the area surrounding the nociceptor, the membrane, which is discriminant to what flows in and out of the cell. Within the membrane, we have sodium channels that are key to the process of depolarization of the neuron for conduction. Without a potential differential between the outside of the cell and the inside of the cell, without that imbalance, the neuron does not depolarize. So here comes our local anesthetic. What does it do? As you can see in the lower image, it sits in that channel and relaxes. No sodium ion flow means no conduction, meaning the brain is unaware of what's going on, hence no pain. The good thing is the anesthetic is finally carried away and broken down by enzymes, and sensation is recovered. Local anesthetics have a variety of ways in which they are administered. They can be applied topically all the way to be injected in your spine. It's great, there's so many choices. There are two classes of local anesthetics: ester anesthetics and amide local anesthetics. Ester local anesthetics are metabolized by enzymes. They have to be metabolized to be effective. They have to be somewhat shorter duration of action. They include benzocaine, tetracaine, cyclomethacaine, and believe it or not, cocaine. Don't worry, it's regulated. The second class of anesthetics are the amide local anesthetics. One of the things about these amides is that they're lipid soluble. They flow right through the membrane and they immediately do their thing. They quickly get access to that sodium ion channel and they're much faster and they last a little bit longer. The cool thing about amides is that all amide anesthetics have two I's in their name, as in lidocaine, dibucaine, mepivacaine, or ropivacaine. Two I's. Here are a few examples of known ester local anesthetics. As you can probably see, they can last from a quarter of an hour, as in with cocaine, all the way to 5 hours, as in with tetracaine. Here are some of the amides. Again, some of them last from a half an hour, as in dibucaine, all the way to 6 hours, as in with ropivacaine. Now we have general anesthetics. Patients are in a deep state of unconsciousness, and the patient does not respond to stimulation. At this point, all sensations are inhibited, and the patient is totally unaware of pain. In fact, the patient will not remember the surgical or diagnostic procedure that was performed on them. General anesthetics have a different mechanism altogether. Here we have our sodium and chloride channels, which allows charged ions in and out of the neuron. As we discussed earlier, impulses occur from a difference in electrical charge across the plasma membrane. In this case, the general anesthetic binds with the GABA receptor and prevents flow of the chloride ions, rendering a total hyperpolarization of the neuron cell, hence no conduction. And of course, this procedure is reversible. Well, hopefully. Here are some examples of the general anesthetics. You have propofol, thiopentanol, ketamine, and etomidate. Just as a summary of my presentation, local anesthesia inhibits pain sensation in a specific area of the body while the individual remains consciousness, while general anesthesia produces a loss of consciousness altogether, and the patient is unaware of pain and does not remember the surgical events. Thank you for your attention, and I hope you enjoyed it.